Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. So everybody listening right now, they are either in medical sales or they want to be in medical sales, or they're somehow part of medical sales, sometimes physicians too. But I don't think people think about the rigor that you go through so that when a medical sales professional is approaching you to talk about their product or their service or their device, they're taking some of those into consideration. So when you went to dental school and then you became an MD, was that just an automatic transition for you? Was that, did somebody plant that seed? Did you say, was that always the goal? How did that?
It's part of the training program. So the oral surgery program is a 6-year program.
Okay.
For the first year, you're an intern. The year 2 and 3, you go to medical. The 3rd and 4th year of medical school.
I see.
Okay. Then you do a year of general surgery, and then 2 more years of oral surgery. So, yeah, you go through a lot of training, a lot of different experiences. I mean, it's a whole journey. And, most of the medical sales reps I deal with, most of them are like plating reps and, they just play, but, really understand because they're involved with the programs, a lot of the training programs.
The reps
they
are
understand. Yeah. I mean, particularly the sales reps that are around like universities and training, they really have a good idea of what happens because they see people at every level, right? So they see the first year, the second year, and they see the attending. So they, if you are a sales rep, it makes a lot of sense to at least spend some time near a training institution so you can get that flavor for what those people that you're going to be selling to are doing. That makes a big difference.
Absolutely. I can only imagine. Going back to the beginning of your career, or not beginning of your education really, was being an oral surgeon something that you wanted from your undergrad days, or was that a kind of a discovery?
No, that was a discovery. I went to college. I actually left high school early because I'm sick of high school, and I was from northern New York. I was sick of being cold, and so it didn't really matter. I did early decision to the University of Miami. Kind of had an idea that I wanted to be a doctor. That I liked the medical field. My mom was a nurse, so I sort of had that keyed in. Some doctors I knew, not a lot. I respected, and it was just interesting. Like science was interesting to me.
Makes sense. So then, what prompted the PhD? Was that also part of the program, or was that a conscious decision after everything?
Yeah, no, I mean, so right after college, I spent just about 4 years working in a laboratory at the University of Maryland, Baltimore. And so that, that kind of, I got a lot, I ended up getting a really good research foundation there. And so from there, you really can understand how you can look at a problem from, basic science, all the way potentially up to the clinical application. And so it's a really unique place to be. And so I always wanted that to be part of my journey. And so I always kept research. I was always doing research, to dental school doing research.
Okay.
I spent some time at the NIDCR doing research. So it was always
part of your life.
Always there.
Yeah. Okay. So when you think about your space, please talk to the audience and tell us, what does it look like with your interaction with reps? Are reps with you? When are they selling to you? And once they have successfully sold to you, how are you working with them?
Right. Sure. So, a lot of the reps we have very long-term relationships with. So, I started residency like 20 years ago. And some of the reps that were there 20 years ago are still around,
Wow.
yeah, that I knew when I was an intern, right? And
Okay.
so, we know who they are, we know their family, they know our family, so it becomes a very, very tight relationship.
Sure.
And as time goes on, they move up the sales ladder and they, bring in their associate reps and whatnot. And so that, I mean, it becomes a friendly relationship. And every, and usually the way we work is, it kind of depends on the level of their involvement you need on their product. So some of the longtime reps, we know their product better than they do. And so they don't really necessarily need to be in the operating room with us. But if it's other things that we don't have as much experience with, just using, then they're always in the operating room, just standing in the corner, ready to answer a question. Just Johnny on the spot. And so that's kind of how it sort of develops.
Sure.
I mean, you
Okay.
always like, they would, have a second set of eyes, looking at making sure the instruments are sterile, that,
Right.
this and
Right.
that everything's set. Right, we have residents for that, but it's always good to have somebody, getting your back on that level as well. Particularly when you don't have residents, it's always good.
Sure.
Oh yeah, they got that set up, or the case is going to go here. This.
Sure.
And we can see, and then then we can, whenever you want, we can talk about how things are changing.
Right. No, so we'll get there. So, just so everyone listening can be crystal clear on what it looks like, take us into the room. At first, doctor, can you just clarify specifically what you work on as a surgeon, and then paint the picture of what the room looks like in a typical surgery?
Yeah. So as an oral and maxillofacial surgeon, I do kind of full scope oral maxillofacial surgery. And that means, so, in private practice, and I do some private practice. Private practice is, your bread and butter, wisdom teeth and implants and things like that. And there's absolutely a big role for medical sales there, for, dental implants and things
Sure.
like that. But that's, in the private practice environment. But in the hospital environment, it's mostly the surgery where we're moving people's faces around,
Okay.
orthodontic surgery where we do temporomandibular joint reconstruction, and so there's a lot of that we do, and a lot, most of the time we have the rep for the plating system that we're using that day
Sure.
is in the room. So yeah, basically, how the case starts is the circulating nurse is there, the scrub nurse is there, anesthesiologist is there. They start out by, essentially getting everything ready, the patient prepped, patient goes to sleep, usually gets intubated, and then we specifically wrap the head because we're working at the head and around the breathing tube, and go to work. And that's, essentially that is, so at a minimum, there's the circulating nurse, the scrub nurse, anesthesiologist. A lot of times these days there's a CRNA, a certified registered anesthesiologist, or cut. I think that's
Sure.
how they would know it, is CRNA. And then there's a surgeon, and in a case where there's residents, there's at least one or two or three residents in the room
Okay.
as well.
And is there usually an associate rep, or is it usually one or the other?
Yeah, a rep or an associate rep. Yeah.
Or an associate rep?
Yeah. Yeah. Usually both of them don't come because, they're covering a wide
Right. Trying to cover that.
area, and, and if the introduction has been made and the associate rep, comes around, and we know who he is, and that's great. Yeah.
Awesome. Now, when it comes to that rep, or actually, how long are your surgeries typically? Like the typical surgery, in fact, what is the most common surgery, and how long does it normally take?
I specialize in TMJ surgery. And so like a one side TMJ replacement is about 4 or 5 hours, 4 or 5 hours. And if you do, sometimes we do both sides, that's about 9 hours.
Okay. So let's think about, those are long procedures. Let's think about one of those procedures. What are you expecting for the rep in that span of 8 or 9 hours? Are they helping you keep the room calm? Are they just there to be a resource when you ask a question? Are they doing
So, I
something
mean,
else that people don't think about?
the biggest part, the biggest help is when it comes to actually putting, say, sometimes we use cutting guides, and so the knowing where to point the circulator to, oh, here's the package, and then the scrub nurse, the scrub tech takes the package, opens it, and then, here's the screws, pointing out where the screws are, where the screwdriver is, because sometimes we'll get a scrub tech that is not familiar with the system,
Sure.
and they'll end up needing that advice, and rather than one of us have to kind of like take our concentration away from the patient, and it's awesome to have a rep that does that serves that purpose, and that's great,
Okay.
because then they'll end up teaching the scrub nurse more
Right.
about their set
Right.
and their system as well.
Right.
And I'd say for the vast majority of the time, it's a kind of a limited time. Most of the time, they're just hanging out on their phone because we don't need them
Right.
until that point in time. But they're always sort of paying attention. And if we need something, say we need some imaging or something like that, they're always there to and very willing
Exactly.
to help out.
Yeah. Yeah. And in fact, that was my next question. What does it look like? Is it they're checking in every hour? Are they're there in the room the entire time, but like you said, on their phone, just waiting to be called on?
It
What's the
kind of
normal
depends.
dynamic?
Sometimes they come in and out. I mean, we don't, for the most part, our reps that are with us, they sort of know when they're needed.
Sure.
Just what I explained, and so, we're not going to notice if they're in the corner or not, or if they're outside the door, or even if they go for a coffee break, we're not going to notice. And it's really the critical time is when we're putting their stuff in.
Sure. Sure. Makes sense. So when you think about how reps approach you, think about the first time you're meeting a rep. Give us 2 or 3 things that you love when a new rep is trying to gain your business, trying to develop a relationship. What are the things that say, this is what I want to see?
Yeah. I mean, to me, I like kind of a lower key approach. I don't like to be sold on stuff, and I don't like pushy things. I don't like to see that necessarily, because I might have something that I like, and if you try to push something on me, actually might be negative. Say, well, I've been using this for 5 years, and why should I, and so, and I know, when you're trying to sell something, there are sort of rules, not rules, but guidelines, kind of like don't take no for an answer, whatever it is.
Right.
Is that you have to be, and I'm a pretty easygoing guy, but there are others that are not so easygoing and kind of make immediate judgments on you based on whatever. And those judgments can go forward rather than realize, I realize that my first impression is usually wrong. But some people don't. Some people just take their first impression and hold it against them forever. And so, so I like a subtle approach, just to feel the person, the surgeon out, the people out, and it's not a sprint, right? It's
Yeah.
kind of it's a marathon. Yeah.
No, it makes perfect sense. But I want to get a little deeper into what that looks like, because a lot of people listening right now, they want to be in medical sales, right? They've never had a position like this, or they're in a different type of medical sales that they're not dealing with a surgeon like yourself. So when you say subtle, I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. You say you want someone coming to you pushy. Can you give us a little example of what that looks like?
Pushy?
No, I'm saying when you say subtle and you don't want someone,
Right. So
give us an example.
most of the time, I say that it's usually a pretty effective approach to come forward with something educational that says, our company has developed, XYZ. And I just, if you want, here's a brochure or a website, if you think it would benefit you, be happy to come back and tell you more and buy you a sandwich or whatever. And, something like that, I think is usually a successful way to go. And then on the back end, setting that up with our assistants rather than directly with us, because, we got other stuff to do.
Right.
And so that's usually the way I see it. And most effective, just a nice introduction. This is what we do. This is maybe the benefit that would have on you. If you have a current solution, that's great. If you don't have a solution for it, then here it is. And and like I said, kind of setting things up on the back end, and not have us to worry think about that.
Sure. Think about your best rep then, and it could be one that you know forever. It can be one that you've known for a number of years. What are the top 3 things they do that you just love to see from all your reps on a consistent basis?
They always know what's going on. If not, they make it their absolute mission to know what's going on. And that might be with the case, with the order, with whatever. It's like they are going to think of nothing else until your question's answered. And then just being friendly. And, we're not going to necessarily go out to dinner together, but just being friendly and obviously the more time you spend with someone, the more familiar you get with them, after 100 times in the OR and, you step aside and chit chat and, it's kind of like somebody is like a work colleague at that point.
Right. No, I get it. So earlier you said that in a hospital, you're dealing with certain kind of reps. And then outside of the hospital and clinic, you're dealing with other reps.
Yeah.
Speak to that for our audience members. What 2 different types of reps are you referring to?
So specifically like dental implant reps, you would see most often in private practice. I'll say there's kind of over the last 5 years, for whatever reason, the presence of dental implant reps has decreased dramatically. And I'm not sure, maybe they just, implant companies don't see value or need in it. And then everybody's kind of figured it out. And they don't need to have somebody there sell you all the time. But that's over the last 5 years, definitely something I've noticed. Though that's the vast majority of reps that you really see in a private practice in an oral surgery setting.
Okay.
For the hospital setting, so we do surgeries that require plates and screws to hold bones together. So definitely those reps. We have reps for the TMJ replacement, which actually got bought by one of the plating and screwing reps. So it's kind of the same rep, does the same thing.
Right.
We use sometimes biologic materials, and they'll have different reps. Some of the instruments we use, like some of the saws and cutting instruments that we use, have their own reps. So, and it's all variable. Like particularly if we have a new instrument we're using, that rep will show up 2 or 3 times, make sure we're comfortable, and then we'll be like, you don't have to come anymore. And then, and so everybody's trained. But I would say that, that's kind of the, in my experience, in the oral surgery world.
Sure. Okay. So let's change gears a little bit. You've been doing this for, I think, self-proclaimed 30 years. Okay.
Yeah. So I graduated residency 2007.
Okay. We're almost there. Okay.
Right. Yeah.
So take us back to 2007 and think about any medical innovation that impressed you. And then fast forward to today. What has been, in your opinion, the most impressive innovation in your space?
Okay. So back then when you're just starting out, everything's new. So you kind of like just figuring out what your role in the world is.
That's fair.
Yeah, that's a good question. I'm just trying to think what would, at the time, maybe a different like plating design, not necessarily earth shattering to me or anything like that, but that would be one thing. I would hear the reps talk about plating design, things like that. And then, nothing, I was, it was outside of my specialty because we do 6 months of being, an anesthesiology resident and being an anesthesiologist. And I saw a lot of stuff there that was pretty amazing, like particularly like neuroangiography, things like that, where they're, up in the
Neuroangiography.
yeah, so where they put basically a cannula in your leg vein, and they sneak it up all the way to the vessels in your brain. So if you've had a stroke, they can kind of clot that off. And I know that was very impressive. So that was kind of in the beginning stages, and so that sort of thing, I think, was the most amazing. But again, when you're just starting out, it's all kind of new. So
Right. I guess the better question is, what's the biggest technological innovation you've seen up until today?
I think virtual surgical planning, honestly.
Talk to us about it.
So that is, so when I first started out, like say orthodontic surgery, where you rearrange a person's jaws because they're like say the upper jaw is too small or the lower jaw is too big. So we do surgeries where we can rearrange things. And when I was an intern, we used to do them just on stone models. And we used to literally cut the models and glue them back together when we got them in the right orientation. And then we would make a splint, like physically make a splint on that model. Okay. Now we take a CT scan and we get on a Zoom call just like this with a technician on the other end who has the CT scan all set up and 3D reconstruction done. And he'll do the virtual surgery where he makes the virtual surgical cuts. Virtually, we'll put the bones exactly where we want. We'll make custom plates exactly where we want. Before we would bend in the plates at the time of surgery, so there was nothing custom about them. Okay. And now we plan exactly where the bones go, exactly where the plates go, so we know we're putting the bones where we wanted them. And yeah, I mean that's revolutionary.
When did that innovation first come around?
Probably, time flies so fast. Maybe 4 or 5, maybe like 6, 7 years ago.
Well, in your career, it's fairly recent.
Yeah.
What did that do for? I mean, and of course, there's data, I'm sure, but just from your opinion and what you saw, what did this do for accuracy of procedures? I mean, did it 100% increase, 200% increase? I mean, talk to us a little bit about that.
No, I mean, to me, it's a 100% increase, that obviously being very, very ballparkish. But like, when you're doing a lower jaw surgery, before there was no real way to tell where your jaw joint was going to end up. Okay. You just sort of like pushed on it and hoped that it ended up kind of in the right place so that it didn't relapse when you took everything, everything off. But now where we can put the jaw joint and make a custom plate exactly where we want it. So we know that jaw joint is going to end up where we wanted it. Because like I said before, if it didn't, it's like you either have to redo it or accept it or whatnot. So, that sort of thing has really changed how we can best serve the patient, really.
That's awesome. And with what you just described, oh gosh, we're gonna have to edit this one. I had a question for you and I just lost it. Okay, yeah, because I wanted to actually ask. So if that's the virtual is one of the biggest surgical innovations, what has it done as far as speed of the surgery? Are surgeries faster now because of this, or it doesn't really impact that? It strictly just impacts the success of the surgery and knowing where to put things in the right place?
So I'll tell you, some surgeries are faster.
Okay.
Sometimes I would say it doesn't because there's still a learning phase going on right now of companies iterating their custom plates and screws. And so as they go through those iterations, the performance or or ease of use, I think, is improving, but that takes some time sometimes when the ease of use isn't so great. And, and maybe the next time, we give them feedback and it will be. So on that level, it's getting better. The speed is getting better. On the dental implant side, what is improving speed and increasing speed is we're able to, same thing, virtually place implants, right?
Right.
And so we take an in-office CT scan, send it to a lab, and with the lab, same thing. We go through with a technician on the other end. They're placing the implants where they need to be, and then at the end of our treatment planning session, they make a guide where exactly where the implants go. So the guide we now we obviously have to drill into bone to make a hole for the implants. So the guide is exactly where we planned it, and it does increase the speed and accuracy a great deal. So similar type of thing, but and every application is a little different. But between dental implants and or like say orthodontic surgery,
That's amazing. So what type of technician is this that's doing it on the other side?
So they are, I don't know what you'll call it, somebody who knows how to run the software. And so,
It's
so,
from
so you
companies
say,
whatever software you're using.
yeah, and usually it's the plating company or the company that's selling us the hardware. And the vast majority of the time, the rep is on that call too. So that's another, so the rep will be there to make sure it's intact and nothing gets lost.
Right.
And so,
Right.
that's a kind of a new role for a rep, is to facilitate that virtual surgery.
Okay.
And so it's a very, I guess that's pretty interesting, actually.
Yeah, no, it sounds like it. How has AI impacted any of this?
It's coming. It's coming. So there are so there's still very much, I think, a desire to have a human in the loop, no doubt. But, AI manipulation of imaging, AI is going to be able to place implants. They're going to be able to, design custom plates. There's nothing it won't be able to do. I think technically, then it'll just be able to, eventually, not need the technician so much. But really what the technician's for is somebody to know how to use the planning platform.
Right.
And
But
so
if that can
AI is going to be able to do
AI,
that. Yeah. And so, at some point, the surgeon's just going to look at it and sign off on it, kind of like the way we do now with a live technician. And I think that probably mostly will be one of the big advances. 'Cause I think everybody's trying to find a solution that will involve AI. Some of it is not necessary. They're just kind of doing it because it's AI and it's more.
it's the latest thing. It's the latest thing.
Exactly. But there are places where it really will provide value and patient benefit.
I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolvesuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.